Good afternoon and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, the Executive Director of Whitewater Community Television. Thanks for joining us for this live interactive conversation with two of the area's doctors, Dr. Thomas Huth from Reed Health, Dr. David Jetmore, Wayne County Health Department. Gentlemen, once again, thank you for making the time to do this for the community. They appreciate it.
Glad to be here.
As we normally do, I want to start with what you've learned during this past week. I'm not going to talk to you yet. You may take a little while. we'll start with Dr. Huth. Give us your feeling on this past week.
Well, I'm constantly monitoring the data across the world, nationally, regionally, and we are seeing increases continuously, and a lot of increase in the United States, but it continues to be the big states that we've talked about for several weeks: California, Texas, Florida, Arizona, but some other places are guttering up as well. That much hasn't changed, but I think one thing that stands out to me is earlier this week the CDC released a morbidity and mortality weekly report, which is a publication for healthcare professionals of items of interest from a public health standpoint, and it described the contact tracing for a particular outbreak of COVID-19 in Missouri. Two hairstylists who worked in the same salon. They're BFFs and spent a lot of time together outside the salon, not in masks. Well, they were both sick for a week and working before they were both tested for COVID-19, and they were both positive. And so when they went back to do the contact tracing of all their clients, there were 139 clients between the two of them in that time who were felt to be at risk. And in follow-up, not one of those 139 were positive, were sick, and 65 of them were tested, and not one was positive for COVID-19. Now, how did this happen? They're standing in close contact with, ladies, one on top of another for half an hour, 2 hours, whatever it is. Yet none of these people got sick. And what it traces back to is that salon rigorously enforced the local mandatory masking policy. The stylists all routinely wore masks. The clients all wore masks. And I think that this kind of vividly demonstrates the value of masks. And that's just one of many possible demonstrations of this. And we've gone through an evolution of masking where early on we weren't sure of the value because of the filtration ability of medical masks, even medical masks. But the reality is that viral particles are transmitted on vapor, moisture droplets from the infected person. And if you can capture that before it has a chance to evaporate into the small particles, that's the best opportunity to avoid the spread of COVID-19. And that's why I think we're seeing a lot more mandatory masking regulations around the country. And even across some states.
Coming up during this hour on Ask the Doctors, we'll be speaking with Jennifer OBrien, Assistant Superintendent for Richmond Community Schools, along with John Weber, Vice President of the Board. We'll be speaking with Dr. Erica Brandenstein in just a little bit. I'm going to turn to Dr. Jetmore, troublemaker.
Well, I have no idea what you're alluding to, Eric.
I'm sure you don't.
I would never cause any trouble, but it may be the fact that there was a Board of Health meeting yesterday, and I was asked what I thought about masking, and Dr. Huth and I are of like mind here. This is one tool that we have that can really blunt spreading infection from this virus. And I was asked by Paul Ryder, the president of the board, what my thoughts were. And I told them, and still feel this way, that anybody that's inside a building should wear a mask. Everybody in the store, the clerks, and the patrons should all wear a mask. If they're outside and can't socially distance, they should wear a mask too. Well, the board This was made as a motion, and the Board of Health voted unanimously, I have to say, that this is their recommendation. Now, the Board of Health can't issue a mandate for the county for people to wear masks, but the commissioners and the mayor can issue a joint mandate that would cover everyone in the county, and I'm hopeful that this will happen. There are a number of reasons for this. There's two problems here with this pandemic. One is the severe stress to our economy and to these small businesses. People are trying to run a business. People are working in those businesses trying to earn a living, and yet we're trying to keep everyone safe. We can have our cake and eat it here. We can put a mask on, go in, buy your groceries, walk out the door, take your mask off. We can have our lives back, or keep our lives in this instance, if we wear masks. So we'll see how this goes with the commissioners and the mayor. The other thing that was in the news was the Governor Holcomb said that if there are gatherings of more than 250 people, that anyone involved in these gatherings, whether it be a fair, a wedding reception, family reunion, an event by a nonprofit, that the plan for this needs to be submitted to the local health department, which is a lot of work. But we'll accept this role. One of the things that I will say to anybody submitting a plan is we will recommend masking to anybody that submits a plan to us. So if you're going to have 250 people gathered together, they need to wear masks. So that's what's happening lately, Eric.
Okay. If you did not read the newspaper article that was written up about the health board meeting, immediately following this show on WGTV Channel 11, we actually will have that entire health board meeting. So as opposed to hearing a snippet or kind of getting some things out of context, you can hear the entire meeting for yourself. It's also available on WGTV Online, our video on demand site. So those things are there for you. You're both saying that masking is incredibly important. You're beginning to get your wish over the last couple of days. Grocery stores, Meijer, Kroger, Walmart, Sam's Club, Menards has done it for a long time. Many more stores are beginning to say that they are going to mandate mask wearing, not only by their employees, but whoever comes in. I assume you all are 100% behind any of those stores that decide to do that.
Exactly. And these stores, they want to stay in business. You know, they want their customers to be safe. They do not want to be a mini outbreak for COVID. And you know, we're in a unique place here in Wayne County. We're just starting to see these numbers tick up, and rather do what is done in other parts of the country. And I have to mention California, Florida, Texas. We're not waiting for these numbers to get out of control. We can manage these numbers and tamp them down. You know, the paradox is you've got to do this early. Once we have all of the Dr. Hughes respirators are at the hospital in full use, once we have we're overwhelmed with contact tracing at the health department, it's almost too late. But this is a unique time for Wayne County. We've managed to keep these numbers down all this time, and we can seize the moment here and keep going. We can keep our economy open. We can keep our citizens safe.
Okay. We've got Dr. Erica Brandenstein, an OBGYN and no stranger to the WCTV studio, joining us via Zoom this week. We're going to bring her in. She's been here on a couple of different occasions, particularly on a couple of our Let's Talk programs, which are done through the Humanities and Social Sciences area of Indiana University East. Dr. Brandenstein, thanks for taking some time and being with us.
Great, glad to be here.
I'll let you two have the floor.
Well, maybe I'll start it off, and Dr. Jepmer can think of some things to talk with you about, Erica, but I want to thank you for being here, agreeing to be here today. It's really fun to do this. I hope you'll agree. And I thought it would be fun to talk to you, particularly from the perspective of an obstetrician gynecologist, because I just would imagine that normally in your role, the bugs going around or pandemics are not really top of mind for you. You've got other important things on your mind, or expect other things to be affecting your practice. But COVID-19, nevertheless, is here, and it has affected your practice. Tell us a little bit about your experience with COVID-19, how that has changed your practice.
Of course, I'll tell you. So definitely when we first really started realizing how serious the disease was, our practice was significantly limited in that a lot of our patients couldn't be seen. And so the patient that needed just like regular cancer screenings, needed birth control consults, those patients, a lot of them we were actually able to get seen by telehealth. So telehealth was a good thing that I think came about with COVID-19. And we have started seeing more patients in the office again, and I think we're getting caught up with everything. And then, of course, we've also been doing all of the screening that's been implemented across the Reed Health system, and, asking patients about their history, taking temperatures, making sure everyone's wearing masks, and making sure that people are safe when they come into the office. We've spaced out the chairs in our waiting room. We periodically have people come and clean the waiting room multiple times throughout the day. We're very, very careful about that. And one drawback, I would say, one major drawback was that we actually had because of some of the fear of the virus, some of our pregnant patients were not getting regular prenatal care. So we've tried to get the message out that, you still need to come in, you still need to get your prenatal care. We're taking all the precautions that we need to take, and we're going to make sure that you and your baby stay safe.
So, lots of people have fears for themselves and according to their conditions and so forth. What do we know about the risk for pregnant ladies with COVID-19, or do we know very much at this point? What do you tell your pregnant ladies about their risk?
Well, the CDC actually recently published data on that. So we found that pregnant women, when compared to non-pregnant women, were more likely to have an ICU admission if they get COVID-19. It was 1 in 68 versus 1 in 110, I believe. And then pregnant women are also at increased risk of ending up on mechanical ventilation or respirators. And that was a 1 in 195 pregnant women versus 1 in 376 women in the general population. So definitely we have some data to suggest that pregnant women may be at higher risk for having a more severe manifestation of the disease. However, the mortality rate is not higher for pregnant women at all. So, that's a positive, but pregnant women are at increased risk for getting very ill.
And then the other party to a pregnancy, of course, is the baby. And what do we know about risks to the baby in this scenario?
So vertical transmission from mother to baby is extremely rare. There's a couple case reports of that happening, but the likelihood of a baby being born with COVID because the mom had COVID-19 is, I would say, pretty much slim to none. There are very, very few documented cases. And even in those cases, I don't think they were able to completely prove that the baby contracted it while it was still in the uterus.
Well, at least there's that good news. So what do you tell pregnant ladies to do to protect themselves? Is it any different than the rest of us?
Well, just because we do know that they're at higher risk for having a severe manifestation of the disease, I just like to emphasize to my patients just the importance of prevention. They really should stock up on needed supplies and avoid going out into public spaces when that can be avoided. They should always be wearing masks when they're out. Frequent hand washing is essential, but it's also essential to continue to get your routine prenatal care so that we can keep you healthy.
Perfect. I'll stop there and see if Dr. Jetmore has any questions for you.
Tom, you've asked all the good questions.
That's why I go first, so I can take them up.
You soaked up all the good questions, so I don't really have anything to ask of Erica, but I do want to thank her for being here with us today and sharing her knowledge with us.
Thanks, Erica.
Thank you, Dr.
you.
Brandenstein. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming live on Facebook, and also available on CTV3 in Connorsville. We're speaking with Dr. Thomas Huth from Reed Health, Dr. David Jetmore from the Wayne County Health Department, and I'm going to speak to, if you can pull up the wide shot, there was a statement on Facebook that I do want to make sure that I get to. Someone mentioned that our first conversation was talking about maybe mandatory masking and that we weren't wearing masks. I can say that we talked about that very early in the show. One of the other things you will hear them say a great deal is, wear a mask if you can't social distance. That social distance is 6 feet apart. And if you were to put a ruler between the legs of these chairs, because we actually measured, these chairs are actually 6 feet apart, and we do wear our masks into the studio. I've got mine, Dr. Huth has his, Dr. Jetmore has his. We can't come into the IU East campus or into any building here on the IU East campus without having our masks. It's mandatory that our staff is wearing those during the day when we are here, not necessarily when we're in our independent offices, but when we're in any public space, we have to have those. So just to let you know, we're not trying to tell you to do something that we are also not willing to do, and I'm not suggesting anything. That's why I have them here. We've got some questions that we had come in. Since this is Ask the Doctors, let's take those, and we are still taking your questions. You can send them on Facebook or send us a tweet at WCTV Info. So let's see if we can get some of your questions answered first. Can the health department require churches to have members wear masks while attending services? If so, who and how would that be enforced?
Well, we want people that aren't socially distanced. I mean, if they're at a religious service, we want them to wear masks and to socially distance. The health department does not have a lot of real enforcement powers. So far, this has been a recommendation, and we have seen a couple outbreaks in churches, both here and right across the state line in Ohio. But that may all change here in the next week or two, because this may be mandated if people are in church. Anybody that's inside in a building will be required to wear a mask. So that'll be the state of affairs then.
Okay. Next question up.
This must be a long question, Eric.
I'm scared by this one. Are the forehead thermometers and iPad app thermometers accurate? That's something that a lot of people, I think, will probably continue to ask as they go back to school, they go back to work. That we're being asked to check ourselves every day, check our kids before we send them out. What should we be using?
Well, you know, one of the reasons we use these forehead thermometers, and I'm not really familiar with iPad app, but I will talk to forehead thermometers. I think they give sufficient accuracy. You're in a screening environment, maybe you're waiting there to get into the courthouse, maybe the annex building, somebody's there taking your temperature. I think there is some inaccuracy if you've been working out, running, and your face is flushed and sweaty. It might give you a falsely higher reading. This thought kind of brought a smile to my face, but the most accurate temperature reading, Eric, is a rectal temperature. And this would cause a lot of problems if we had people line up for very accurate rectal temperatures. So
You think?
I'm in favor of forehead temperatures at present.
Yeah, that's right. Oh, that's right. I am not at all familiar with an iPad app thermometer, so that would be a new one. I mean, I'll have to research that. But basically, the more removed you get from that rectal temperature, you sort of have to adjust your expectation of normal temperature down a little bit. So an oral temperature is probably a little less accurate than the rectal. The eardrum temperature is a little less accurate than that. Forehead temperature a little less accurate than that. But the beauty of the infrared type, I think it uses infrared forehead temperature is that there's no touch, so there's nothing to decontaminate afterwards or become contaminated, and it's super easy to do. So you got to balance all the factors, but I think I'd rather see the forehead temperature than probably other kinds, because then we know that we can't accidentally cross-contaminate people.
Just a quick follow-up. You mentioned if you've been working out or something and take your temperature, are there other things that we need to be thinking about before we check our temperatures in the morning? What we're drinking, what we're eating, can that in any way affect
all
what
that's yes.
shows up?
Like, for instance, if you're drinking hot coffee or something, maybe iced tea, and then take your oral temperature, it's going to affect the temperature up or down accordingly. But in addition to that, Eric, things like taking Tylenol or aspirin or ibuprofen are going to maybe lower the temperature and it's not an inaccurate reading exactly, but it may mask the presence of a fever. So it's best to try to take the temperature, say 4 or 6 hours, no less than 4 or 6 hours after having had a fever-reducing type medication. And so, yeah, there are things like that. I myself had the experience just a couple of weeks ago. It was hot out. I had to stand outside doing something outside in the sun with the sun on my face, and then I had to run and get in the car, and the car never got really cool enough before I went to the next place where going in I had to get my temperature taken. Well, my temperature was 99, I think, 99.1, and that was a little bit above their threshold for the forehead temperature, so I had to sit and cool off and wait to recheck it. So those are the things that we're going to find to happen, that there are environmental factors that are going to affect it.
One more before we go back to the questions. We talk about what we learn new every week. Is fever still one of those symptoms that shows up? You've talked a lot about asymptomatic people who may not have it. Is fever still a part of what we believe shows up in those with COVID-19?
I think it's what we understand is that fever is present in 95% of COVID-19 patients at some point. It may be up and down, come and go. So if you have a COVID-19 patient and take their temperature, at that moment they may not have a temperature. That's why relying strictly on temperature is not going to be a very good screen. It's really in combination with other things like asking about symptoms or exposure or the like. But I think the one symptom that I like a lot that's probably actually going to turn out, and the additional research is showing this, that is probably more consistently present, is the dysfunctions of smell and taste. Those typically precede the onset of other symptoms and tend to last more, have more duration during and after the illness. And so I think if you could ask just one question, it would be, have you had a disturbance in your smell or taste recently?
I agree. Fever is kind of a general indicator of all infections in your body. So it's a very, very broad screening device. As Dr. Hughes points out, we don't know when the fever is going to occur during the course of having coronavirus infection. So, but I think in terms of a screening tool, entering a building, I think that, and asking the person entering the building if they've had any of the common COVID symptoms is the best we can do at this point.
Okay. Your questions being taken on Facebook as well as at WCTV Info if you're using Twitter. Let's see if we can get one or two more in before we bring in our next guests. Has anyone been proven to have COVID-19 for a second time? If so, could this suggest that a vaccine would not cover a person long term against getting the disease?
Well, yes, people have gotten COVID-19 for the second time. Dr. Hughes and I, and I think everybody's learned so much since this went on, we were hoping that people would get this disease, or people who got this disease would have antibodies of such a level that they would have immunity for 10 or 12 months. However, we found there's been some studies done in Spain and in England which have shown that people's antibody levels are very high when they first get COVID, and then they drop off to very low amounts, non-protective amounts, after a period of 6 to 8 weeks. This is very disappointing because in the beginning we thought people would have this, would get the infection, they'd be immune for a year, we'd build up herd immunity. It's not a totally discouraging thing because that's just part of the immune system antibodies. We've still got T cells and B cells in the body that fight infection. People ask, does that mean a vaccine won't work? Well, vaccines often cause a much higher level of antibody than the disease itself would cause to happen. If we look at things like measles or hepatitis A, the antibody response is so good that you have a lifetime immunity. Some vaccines don't last that long, and this may be a vaccine where we have to have a booster shot. Once those antibody levels fall, we need to give a second injection. What have I left out, Tom? You probably have something to add.
Not really much, but you can use other examples where the vaccines are very highly protective for a long period of time and others not. This seasonal influenza vaccine, as an example, probably has antibody levels that drop off in a couple of months. And in some particularly severe flu seasons, we've actually given booster shots to certain high-risk folks toward the end of the flu season to make sure that they're covered. And you mentioned the T cells and such, and I think that's an important part of the immune system that is there and we hope will have an impact on with COVID-19. But some of the T cells, the memory T cells, actually store a memory of pathogens so that even if the antibody levels wane, another exposure to the same pathogen can reactivate the antibody production faster, and that may also, that obviously also provides some protective benefits. We're hoping that that'll be the case. I've seen one study from England where they thought that the memory T cells would play a large effect, but all this is very preliminary, and we don't yet know the long-term impact of either, what happens with immunity with having the disease directly or what does the vaccine do. All this is pretty much unknown. But the original question was, have there been people who have had it twice? Yes. Fortunately, so far, that does not appear to be a common thing. They appear to be exceptions, but who knows what we'll find out about that in the future.
I would add that they've also said people who are asymptomatic, which is people report 45 to 50%, their antibodies levels are lower than people who really get sick from the virus. They have more of an immune response.
We're scheduled to speak with Jennifer OBrien, Assistant Superintendent for Richmond Community Schools, and John Weber, Vice President of the Board. Let's get one more question in before we go to them, if we can do that. I heard you say 99.1. We are going by 100.1 or above. Could you address, please?
Well, I might have mentioned 99.1. That happens to be the threshold, a lower threshold, admittedly, than some other places are using. But this was going into a long-term care facility where we're being extra careful. So every organization, every location choices have to be made about what our cutoffs are going to be. I think 100.1 is defensible. I think that might be what they use at the county building.
It might be 100.4.
Okay. So we're going to have a variety of them, but they're all kind of going to be in that range, somewhere between about 99.1 to 100.4, probably all in that range.
So if somebody says you have a fever at 99.7, that's just what they're using as their number.
Yeah, right.
Okay.
Yeah.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, and also available on CTV3 in Connorsville. I think we have our guests. Jennifer OBrien, Assistant Superintendent for Richmond Community Schools. John Weber, Vice President of the Board of Directors for Richmond Community Schools. Thank you both very much for taking some time and joining us this afternoon. We greatly appreciate it.
Thank you.
Thank you.
Just kind of want to jump right in. You've made the decision to offer parents, and it just came out this past week, the option of doing either in-person, face-to-face, or virtual learning this year. Can you talk to us a little bit about why you decided to make that choice and when parents need to make that decision? I think the date is coming up pretty quickly. I'm not studying it because I don't have one in your school system anymore.
Yeah, it is kind of a quick turnaround time. We're asking that parents let us know their intent by Tuesday, July 21st. That just helps us plan for staffing and, as we get ready for the start of the school year. We felt that it was important. All of the superintendents across Wayne County have met, throughout the summer in planning for the preparation, of the opening of schools. And we do know that there are families have different situations and different needs, and so we just wanted to make sure that we were offering something that would benefit from choice.
For those parents trying to make that decision, how do they get that information to you? How do you know, and what will you do with it? Do you have any anticipation, any feeling from conversations you've had with parents? Will there be more kids face-to-face, more kids virtual learning? Have you had any feeling? And what are your teachers' reactions to these options?
Yeah, so we monitor the numbers. They're coming in. We anticipate that we're going to have more students face-to-face than we do selecting the virtual option. It's just an unusual time and just it's new for everyone. It's new for parents. It's new for teachers. And it's just, school is just going to look different when we come back. And so trying to navigate, how do you manage teaching live students in a class while also managing, a virtual classroom? And that's why it's, so important that we hear back from the community so we can gauge those numbers to see, do we have enough students to participate, for example, in one grade level where we could assign a teacher to just be in charge of a virtual classroom, is a little different than if you just have, one or two students where we just couldn't designate an entire staff member, for that. So, we do anticipate there'll be some blended learning where, unfortunately, teachers are going to have to manage both. As far as the information, we have different venues. Obviously, social media. There's been a push there. We have a messenger system where that sends calls and text messages to families. The information is also available on our website. It's a simple Google Doc form that just indicates the intent to participate in virtual instruction.
When you say school is going to look different, can you give us a little bit more information about what that looks like? Are you trying to put desks 6 feet apart? Will they have to wear masks while they are in school in passing periods? What does lunch look like? Can you provide us with a little bit more detail?
Yeah, students and staff will be wearing masks. You'll be required to wear a mask when you enter the building, when you're in the hallway, during passing periods, when you're in line for lunch, and at times when social distancing can't be achieved. So obviously, at lunch, we're going to have to spread out a little bit further. For example, at the high school, you may be seeing kids that are eating in the lunchroom. We may have makeshift lunchrooms set up in the Tiernan Center just to try to get that social distancing during lunch.
What How has this and what you all are about to go through changed what your school lists look like for students? There's normally these lists that we find in various places of what kids need to bring. Do they need to bring more things? Do they need to bring different things? How are some of the maybe personal PPE for students being handled? Wiping down desks, being able to share. We had questions a week ago about sharing puzzle pieces and things of that nature. Talk to parents about what some of that will look like for them.
And not just the school supply list, but our own district supply list, and just the things that, just the, hand sanitizer and PPE devices and cleaning solutions and all of those things that are kind of a hot commodity, and that you have to kind of manage to make sure that you are getting those things ordered, in time for them to arrive. As far as the actual school supply list, we will be providing masks for staff and for students. We did add masks onto the school supply list, as well as a water bottle. We'll have water available to students, and we'll be able to fill water bottles, but we are going to shut down just the traditional drinking fountains that you put your mouth on. So water bottles have been added to the school supply list. Clorox wipes and hand sanitizer are usually listed on the school supply list. However, we know that those items, are hard to find, and that may be a difficult item for families to be able to purchase, which is why we have tried early on to purchase some of those items.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We're speaking with Jennifer OBrien, Assistant Superintendent for Richmond Community Schools. John Weber is also with us, Board Vice President. I've kind of been hogging this. I'll turn it to the doctors, see if they have a question or comment they want to throw in here.
Sure. I'd like to hear a little bit from John as a representative of the school board. What are some of the things that the school board, sort of the principles that the school board are taking into account in deciding how to operate the schools safely this year?
To follow up on Jennifer, safety is the priority, and so we need to, every decision that needs to be held in place. I look at it as mitigating risk and then a transmission, kind of two separate pieces. And I think our plan addresses both. Obviously, the social distancing and face mask apply to transmission, and then risk is what activities. Does it make sense to have sports or band or extracurriculars? And so we look at those one by one, and that's kind of at the board level, I think, a little more where we're at. Also, asking for plans. So if we're comfortable with the opening plan, what if things change? What if we have to go to a more stringent level? What do if we would have to go all virtual? So those are things we kind of keep in the back of our minds, where we might be heading, trying to anticipate what could happen in the future, which is nearly impossible.
Sure, but I think I heard in your answer that the board maybe has an idea in mind about some way to kind of track what's going on for deciding whether we're being successful with the initial planning and when changes need to be made. What are some of the things you have in mind to monitor, and do you have, or are you working on some standards and thresholds for making changes in those plans?
Well, we've worked very closely with the Wayne County Health Department, and even this week we brought all of the county school nurses together so they could have a chance to work through some of those plans and collaborate with the health department on what that's going to look like. Just making contact with the health department. We're tracking. Basically, we have a spreadsheet that we're tracking. Which we do anyway with clinic visits and symptoms, that type of thing.
Okay. Now, when John was talking a minute ago, he mentioned two things that I think are good to a good way to think about, kind of break down the problems. One is the risk, and I assume you mean risk to the children, John, when you said that. Then you said transmission, and there I'm assuming you mean transmission to other people at risk, like maybe the adults in the in the buildings or in the community who are at higher risk. And if that's correct, I think I'm wondering if you have any. You're probably aware, I'll put it this way, that there are differential risk numbers or risks associated with different age groups. And if you stay tuned, and we can get to that, I brought an exhibit today that shows some of the risk associated with different age groups, specifically the case fatality rates by age group, which is admittedly the worst possible outcome. Basically what we'll be able to see from that is that the risk to children, healthy children, is actually pretty low, but I personally have a concern, particularly about the adults in the school environment. What kind of safeguards are aimed particularly at protecting them?
Well, I mean, I think that was, kind of the thought and premise behind the plan itself. And so, knowing that we have adults to protect, but, and that is why, we're masking. We also have even shields. We have plexiglass dividers. For example, if you're in a speech class, it's difficult to teach a student, when you're masked, when you're teaching a speech class. So we do have face shields, plexiglass dividers, and so we just have lots of things in place to help with those protections that just look a little different than what we are used to a classroom looking like.
Jennifer, you probably answered this earlier, and I was too obtuse to really determine what the answer was. In terms of learning in the classroom and learning online, are these going to be synchronous? In other words, the children are in class and there's a camera there recording that class at the same time that the children at home are watching? Or will it be an asynchronous program where you've got the teachers giving a separate lesson plan for the children at home?
Mm-hmm. I think it really will be a hybrid of both, and I think that's an important message. And when we're reaching out to parents that have signed up for virtual learning, that's one of the things that we want to make sure that they understand, because prior to this, we've had e-learning days, which occur on a snow day, where the students have assignments to complete, on the computer at their own pace. They can do it, throughout the day, in the evening if they choose. In the spring, when we were closed, there was just a different level of accountability and requirements from the Department of Ed. And again, it was a work at your own pace, not even just throughout the day, but you could work throughout the week on assignments. So virtual learning is very different because, it would be that, your math class is at 9 o'clock. And so therefore you need to be, at the computer logged in at 9 o'clock, to receive that instruction from the live teacher. When we're doing e-learning or the extended learning opportunities, and it's, activities enrichment, but for virtual learning, we really need new learning to take place. We've got a lot of ground to catch up from having been closed from March. So again, I think that's one of the things that families, really have to consider. And I feel for families. I'm from Richmond. My friends and family are here. My own children are here as well. And it's a difficult decision. Leaving a high schooler at home to manage virtual learning, is a little different than a young elementary student that would be, navigating learning during the school day. I mean, I would think, a kindergarten or first grade student would have to have a parent, or, most elementary schools would have to have a parent or an adult there to help manage their learning.
Yeah, exactly. One final question, at least from me, is I worry about these children that were, when we closed the schools back in the spring of the year, how much they missed. Are there any plans for testing to see where the children are need to catch up, and maybe methods to bring them up to snuff, so to speak?
Oh, absolutely. I mean, I think that's going to be imperative, when we get back to school. The recommendation from the Department of Education is to make sure that you don't, get hung up on feeling like you need to pick up where you left off in March, that, some time has passed and now these students are in a new grade level, and we need to focus on the grade level standards. And so that's where we'll start, knowing that as we do that, we're going to be assessing students, and then we're going to have gaps to fill in. We do that regardless, because there is a little bit of a summer slide, and there are always students that need remediation, but we anticipate that this is going to be there's just going to be more of it. So we look at ways, within the school day to provide that remediation. And then, we'll continue to monitor, the guidelines from the governor of state to see, what other things that we can offer if we start venturing into, after school tutoring and some things like that as well.
You're watching Ask the Doctors on WGTV Channel 11 and WCTV Channel 21. We're speaking with Jennifer OBrien and John Weber, representing Richmond Community Schools. A couple of quick questions, and then we'll let you go. We had one come in. The decision that parents are making right now between face-to-face and virtual learning, is that something that has to hold for the entire year? Or is there a plan where maybe at mid-break, after the Christmas break, whatever your calendar is going to look like, could kids who maybe were virtual learning, can they be reintroduced back into the school system? Is that going to be an easy process for parents one way or the other?
Oh, absolutely. Absolutely. And again, that's why we wanted to offer options, because what you choose in August and works best for your family may not be the same thing that works best for you or your family, come mid-year. And so, we'll always evaluate that and work with parents.
John mentioned some of the extracurricular activities. Obviously, the IHSAA has something to say about this, but you're looking at sports, you're looking at football starting in potentially just a few weeks. What can you tell us about extracurricular activities? How kids who are virtual learning, can they be brought into those after-school activities if they want to be? Have you all thought about any of that, what your sports are going to look like? Will there be spectators? I know the major leagues are dealing with that right now. What are you all talking about in those areas?
Yeah. So I think what you've seen so far is the reopening plan, because it was board approved and it was released. But we also have a 3-phase athletic plan. The first phase started when we came back in July, which July 6th, and that runs actually through the 19th. And so we will be moving into phase 2 on July 20th, and that will run through the start of the school year, and then we'll move to phase 3. At any time, we could move or stay within those phases. So right now, we do have athletics. Their time has been very minimum. For example, in an hour and a half practice time, you don't practice on consecutive days. The locker rooms aren't open, just to give you some ideas of some of those restrictions. Moving to phase 2 would allow intermediate sports to have some minimal practices as well. Some locker room access, but that'll be at reduced capacity. And then, as we move into, school starting, we're just continuing to monitor to see, the different events and if they're still a go or if they've been canceled or postponed. But depending on the guidelines, again, from the governor and even our local county, then, we'll be abiding by those as we look at, whether to allow spectators, the number of spectators, if spectators will be required to mask, all of those things.
Jennifer OBrien, Assistant Superintendent, Richmond Community Schools. John Weber, Board Vice President. We appreciate your time this afternoon. Thank you for taking some time and talking with us, updating us on your plan. Hopefully we'll talk to you again in a few weeks as things get a little bit closer and some more things continue to evolve here, because we know they're changing on a weekly basis. Thanks for your time.
That they are. Thank you for having us.
Thank you very much.
We've got about 7 minutes left in the program. We haven't reminded you yet that you can actually get a COVID test if you would like. It is still free. That's happening Monday through Friday from 8 a.m. to 8 p.m., 601 East Main Street. You can register by visiting lhi.care COVID testing. They do ask that you schedule an appointment, but they will take walk-ins. I was in a couple of weeks ago. I've been going every couple of weeks and doing it. You mentioned that it can be done every 48 hours last week, I believe. Mm-hmm. So if you are out and about, or if you're an essential worker doing a lot and worried about that, that is a place where you can go and get tested and get your results. Actually, we were talking at one point earlier that the results were a little slow. The results over the last couple of times I've been in have actually been pretty quick in that 48-hour or so range. So we're hearing nationally sometimes that people aren't getting them for 72 hours or more, which is creating some issues. We don't seem to be having that here at this particular time, and I think that's a good thing.
It is.
One of the things we like to do is catch up on some of your numbers. I know we're probably down to about 6 minutes, so we may rush you through some of this, but we want to bring up some of those slides.
I actually did bring 3 exhibits, and actually, Brian and Stephen, if you don't mind starting with that exhibit I brought of the case fatality rates, if there's time to review that super quickly, because it's pertinent to the conversation of schools. So this is calculations I made from the state's website, comparing about 3 weeks ago to now. So the blue bar is 3 weeks ago, the red bar is now. And what we see there across the bottom, the first set of bars is actually the Indiana overall rates. And I don't know if you can zoom in on that, guys, to the left. It's the overall Indiana case fatality rate. That's deaths per total identified cases, positive cases. Around 5%, actually has decreased slightly to 4.81%. The next bit over is really what's important. We've got the 0 to 19 age group, 20 to 29 age group. Those have case fatality rates in the 0.5 to 0.8% range, or 0.6 to 0.8. 0.06 to 0.08% range. That's extremely low. That means 99.94 to 99.92% of kids recover without dying. Now, that doesn't mean they can't get sick. That doesn't mean they can't have issues. But then you compare that to the right side, where we've got the 80 plus, particularly where virtually, over 50% of the deaths are in the 60 plus age range, let's put it that way. And by comparison, the risk of severe outcome for the younger children is actually quite low. But really, the middle bars, the 40 to 50 to 60 age range is probably where most of the staff are in school buildings, and these are the people who are at most risk. And so it's got to be, multi-pronged approach, but it's their health and outcomes that I'm particularly worried about. And so all planning has to include the risk mitigation to them. Fortunately, children are less likely to be the center of outbreak, but when you've got hundreds of children together, that's a different story. Move on to the next one, Ryan, would be the Wayne County cases. It's a set of blue bars, if you can find that super quick. Not that one, but the third one that I brought. These are actually cases that Dr. Jetmore and his colleague Christine Stinson have provided to me, and I've done some analysis of. These are lab positives over the actually since the beginning of keeping the statistics. So these are the cases per week. And we can see that even in May, when we had the most cases at the hospital, the county only had a high of about 15,
Yeah.
15 cases and in a particular week, and we're down lower than that in most weeks. But if you go to the right of the graph, you can see that in the last 3 to 4 weeks, there's a noticeable trend to the upside. And we've actually, this past week, ending last Saturday, had the most cases in any week that we've had in Wayne County, 21. Now, 21 doesn't sound like a big number, but it's a big change from where we were. That's the background to looking at the Reid graph. Ryan, if you could pull that up, Ryan and Stephen.
Last one.
And
there you go.
so this is the set of graphs that we're used to looking at. If you'll zoom down to the right bars, I've added a little arrow to show that where we actually have been trending down, we've actually popped up a little bit. We're only at 17 in isolation beds, but that's not the important one. The really important one is the red bar, gone from an average of 1 known lab positive patient in the hospital a day to an average of 7 during this week, which is almost complete. And while those are not huge numbers, that is a 7-fold increase from last week. And we actually went a whole week before that where we had 0 to 1. So I feel like in the context of the state's noticeable increase, the county is seeing some increase. Reid is seeing some increase, but it's nowhere near alarming yet. I go back to what Dr. Jetmore said at the very beginning, which is that we have an opportunity to prevent that getting worse. And it doesn't really cost us much. We need to wear a mask as the first and foremost key thing.
Okay. Dr. Thomas Huth, thank you very much.
My
We've come
pleasure.
to the end of another week. I know there are probably questions that were asked that we did not have a chance to get to. We'll filter a couple of those to the doctors and see maybe if they have a chance to maybe go on our Facebook page and provide some answers. And we also always try to start with those the following week. So we will bring some of those questions back in next week's program. As always, we appreciate the doctors taking their time coming in. We appreciate Dr. Erica Brandenstein and also John Weber and Jennifer OBrien for being our guests here on Ask the Doctors. Again, free COVID testing is available. Also want to remind you, we talked about this last week, and they're going to kill me because I'm doing my slides a little bit out of order, but do want to remind you that there is an urgent need for blood and that there is a blood drive taking place on Monday, the 27th, from noon to 6:30. The place where you need to register is a little bit different, so I do want to bring that one up. DonorTime.com is where you need to go to register for that. And that blood drive is going to be Monday, the 27th, from noon to 6:30, so do please register, DonorTime.com. Thanks for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11. As always, stay safe, and I wish you well.